Ankle injuries are incredibly common amongst dancers. And some of the more common ones we see are ankle sprains, where dancers roll and invert their ankle, particularly when they're on point. So these can be even a higher mechanism of injury in those situations. We also see posterior ankle impingement, which is where a dancer can develop pain in the back of their ankle due to the pinching of soft tissue or even bony injuries in the back due to that hyperplantar flex position of the foot. They can get various types of tendinitis, either in their big great toe tendon or in their Achilles tendon. We also see stress fractures just because of overuse injuries. And oftentimes we see this when a dancer is trying to compensate for maybe technique errors or insufficient recovery times. Strong doesn't always mean stiffer, and flexible doesn't always mean weak. I think in general that in order to prevent injuries, we need to balance both mobility with strength, particularly in our foot intrinsic muscles, our core strength, and our glutes. It's a full body type of movement. It's not just foot and ankle. It's not just upper extremity. We need to focus on the core. So we need to focus on mechanics in order to prevent injury. And also rest is part of training. Dancers are some of my toughest athletes that I treat. And, having dance experience myself and just also knowing how much we love sports and want to do the things we love, we often can push through high levels of pain because we can just do it and we tough it out. But unfortunately, there are some injuries that if we do that, we really can set ourselves up for failure. And stress fractures are one of those types of situations. And if you think of a floor and you think that if there's a little crack in the floorboard and you keep on pushing through that or jumping on that, it's going to eventually break. And that's very similar to even a small stress reaction or even a bone bruise sometimes, because they're almost, if you think about it in a sense, an incomplete fracture. So if you're pushing through that, and it breaks, that can displace the bone, and ultimately something that might not require surgery could maybe require surgery because it had broken through and became a little bit more severe in nature. And then we also want to look at the whole body. So it's important for us to look at the nutritional component behind this, what types of activities we're doing that are overloading that bone. It could be mechanical in nature. It could be, where we have maybe improper technique, and be able to address all these different athletes for the dancers so that this doesn't prone them to more risk of stress fracture in the future. We often see functional pain that can stem from instability, possibly poor motor control in the foot, some fascial restrictions in the lower extremity, and even nerve irritation. If you think about the dance shoe, you have the straps and the laces, and then the way that the foot is positioned in a small space in the toe box that can really compress these joints and compress the nerves around the foot. So it is possible that one of these things can be altered or injured. In addition, we want to look at all the biomechanics of the dancer, their activation patterns of their muscles, and also see if there's any type of hypersensitization of their nervous system.
Talking about structural damage and different anatomies, how does hypermobility impact ankle and foot stability? And what can hypermobile dancers do to stay injury resilient?
It's important that dancers train proprioceptive types of training mechanisms as well as dynamic stability. And this can be done through physical therapy, where they can help strengthen not only just the ankle, but also the core, the hips, and the back to really be able to set posture up so that you're not at risk for injuring maybe the foot and ankle. So not all strength training actually bulks you up and makes you big, but the right type of strength training can help protect your joints. Anatomy does matter, but I do think that whether you have a high arch or a low arch or any of these things, if you practice proper technique and you condition yourself properly, you can offset a lot of those nuances of the foot structure in order to make sure that you are mechanically sound when you're doing your dance moves. For dancers, you're really relying on your foot for all of these things. And so it's really the foundation. And so instability there can create compensatory reactions up the chain that can ultimately lead to injury. So, for example, if a dancer has an unstable arch, this can cause the knee to collapse inwards to compensate. And then that ends up leading to the hips being overused and having different types of rotation within the hips that then affect the spine. Something that's important is to train the deep foot stabilizers and focus on that. You want to also do some short foot exercises, as well as controlling your hip motions, to avoid compensating your turnout and overpronating. Another thing too is when you're not dancing, making sure that you're wearing, giving your foot some TLC, as we call it, where you're wearing appropriate sneakers and shoe wear, arch support when you're walking, cushions. These are things that you want when you're not in training mode, just to give your body a little bit of a break and to give you good support in your just day-to-day activity. We want to also consider strength and power development too. That should be incorporated. Cross training is always good as well. You want to do some endurance training. And then also focusing on the recovery side of this, which is, sleep, hydration, and monitoring. And one thing that I think we are now starting to talk more and more about in medicine and orthopedics is also the psychosocial component of dance and injury, and the mental component of, if a dancer has an injury, how to return them to sport mentally too. Because one thing that we don't talk enough about is that having an injury takes a mental toll on the dancer, not being able to participate in the things that they love, being scared, to come back because they could re-injure themselves. All of these things are really important, and it has to be incorporated into our treatment plan.
I read somewhere that you mentioned gender-specific differences. What should female dancers know about how their anatomy or hormones might affect foot and ankle health?
Yes, so this is an area I'm very passionate about in general in foot and ankle, because I think we have a lot of data and literature on various other different injuries that differentiate between men and women athletes, in the knee in particular, and even the upper extremity. But the ankle has been something that I find is overlooked, particularly in our ballet population. And so a couple just, high yield thoughts with female dancers are: number one, you are definitely prone to ligament laxity, and more flexibility, which is good, but you are lax. And we're starting to actually look into how during the menstrual cycle, this can actually change, because our hormones do fluctuate, and we have different hormones that can help control stiffness and laxity, such as relaxin and even estrogen. And so it is possible that these hormonal changes, in addition to just us being women at baseline, can potentially pose a higher risk for sprains and overuse injuries, particularly during certain times of the cycle. And knowing that this is something that you can maybe combat with proper nutrition, strength work, cycle aware training, and understanding how you might, during certain periods of time or even after an injury, be a little bit more prone to spraining, that all of these things can help improve overall performance and help your long-term health in general. I do think that there is a mind-body component and feedback system. So I do think that if you're really stressed out, that's going to not only affect you physically, but it's going to, first of all, you're probably not going to eat the way you normally would eat. You're probably not going to focus on your nutrition properly. Your body is going to have very high cortisol levels, which we know can have negative effects holistically on the body. All of these things can prone you to injury, whether it be foot and ankle or just any type of injury. But we see this more in foot and ankle because you're constantly loading through. So I think that goes back into the mental health component of this, where focusing on the physical is incredibly important, but the mental health side of that, and making sure that you're practicing mindfulness and whatever that looks like for you. So being able to focus on healing our mental health will be able to translate into a stronger physical body as well. And so I think that's really great that you brought that up, because it's so important to think about.